Eastern Iowa Oral and Maxillofacial Surgery. For privacy and comfort of our patients and to comply with federal HIPAA laws, cell phone recordings and pictures are not allowed in patient treatment areas. Post-Operative Instructions. Sometimes the after effects of oral surgery are quite minimal, so not all the instructions may apply. Common sense will often dictate what you should do. However, if you have a question, follow these guidelines or call our office for clarification at 319-366-8277. First hour. Bite down gently but firmly on the gauze packs that have been placed over the surgical areas, making sure they remain in place. Do not change them for the first hour unless the bleeding is not controlled. The packs may be gently removed after 1 hour. If active bleeding persists, place enough new gauze to obtain pressure over the surgical sites for another 30 minutes. The gauze may then be changed as necessary, typically every 30 to 45 minutes. It is best to moisten the gauze with tap water and loosely fluff for more comfortable positioning. Exercise care. Do not disturb the surgical area today. Do not rinse vigorously or probe the area with any objects. You may brush your teeth gently. Please do not smoke for at least 48 hours, since this is very detrimental to healing and may cause dry socket. Oozing. Intermittent bleeding or oozing overnight is normal. Bleeding may be controlled by placing fresh gauze over the surgical areas and biting down on the gauze for 30 to 45 minutes at a time. Persistent bleeding. Bleeding should never be severe. If so, it usually means that the gauze packs are only being clenched between teeth and not exerting pressure on the surgical areas. Try repositioning the gauze packs. If bleeding persists or becomes heavy, you may substitute a tea bag soaked in very hot water, squeezed damp dry and wrapped in moist gauze for 20 to 30 minutes. If bleeding remains uncontrolled, please call our office. Swelling. Swelling is often associated with oral surgery. It can be minimized by using a cold pack, ice bag, or bag of frozen vegetables, such as peas, wrapped in a towel and applied to the cheek adjacent to the surgical area. Ice should be applied 20 minutes on and 20 minutes off during the first 24 hours after surgery. If you've been prescribed medicine for the control of swelling, please be sure to take it as directed. Pain. Unfortunately, most oral surgery is accompanied by some degree of discomfort. You will usually have a prescription for pain medication. Taking the first dose before the anesthetic is worn off will make it much easier to manage post-operative pain. Some patients find that stronger pain medicine can cause nausea, but if you precede each dose with a small amount of food, it will reduce the chance that nausea will occur. The effects of pain medications vary widely among individuals. If you do not achieve adequate relief at first, you may supplement each dose of the prescribed pain medication with an analgesic, such as aspirin or ibuprofen. Remember that the most severe pain usually occurs within 6 hours after the local anesthetic wears off. If you find that you're taking large amounts of pain medicine at request intervals, please call our office. If you anticipate needing more prescription medication for the weekend, you must call for a refill during weekday business hours. Nausea. Nausea is not uncommon after surgery. Sometimes pain medications are the cause. Nausea can be reduced by preceding each dose of your prescribed pain medication with a small amount of soft food and a large volume of water. Try to keep taking clear fluids and minimize dosing of pain medications, but please call us if you do not feel better. Diet. Eat any nourishing foods that can be tolerated with comfort. Avoid extremely hot foods. Do not use a straw for the first few days after surgery. It is sometimes advisable, but not absolutely required, to confine the first day's intake to liquids or pureed foods, soups, puddings, yogurt, milkshakes, etc. It's best to avoid foods like nuts, sunflower seeds, and popcorn, which may get lodged in the socket areas. Over the next several days, you may gradually progress to solid foods. It's important not to skip meals. If you take nourishment regularly, you will feel better, gain strength, and heal faster. If you're diabetic, maintain your normal eating habits or follow instructions given by your doctor. Sedated patients. Sedated patients will be groggy for several hours after surgery and should not be left unattended. They will require assistance and monitoring for 24 hours. They should use caution in standing up from a sitting position, as this may cause dizziness. Instructions for the second and third days. Mouth rinses. Keeping your mouth clean after surgery is essential. Use 1/4 teaspoon of salt dissolved in an 8-ounce glass of warm water and gently rinse your mouth. Repeat as often as you like, but at least 2 or 3 times daily. Brushing. It is important that you begin your normal oral hygiene routine as soon as possible after surgery. Soreness and swelling may make it uncomfortable to brush your teeth, but please make every effort to clean your teeth within the bounds of comfort. Hot applications. You may apply warm compress to the skin over the areas of swelling, hot water bottle, hot moist towels, heating pad for 20 minutes on and 20 minutes off to help soothe tender areas. This will also help decrease swelling and stiffness. Healing. Normal healing after tooth extraction should be as follows. The first 2 days after surgery are generally the most uncomfortable, and there's usually some swelling. On the third day, you should be more comfortable, and although still swollen, can usually begin a more substantial diet. The remainder of the post-operative recovery process should be gradual, steady improvement. If you do not see continued improvement, please call our office. We want your recovery to be as smooth and pleasant as possible. Following these instructions will assist you, but if you have questions about your progress, please don't hesitate to call our office. A 24-hour answering service is available to contact the doctor on call after hours. Calling during office hours will afford a faster response to your questions or concerns.